for what I hope is going to be the first of many SkyCast live streams brought to you by SKYGEN. My name is Holly Carter, and though I am SKYGEN's Director of Product Marketing today, I am the host of this webcast, live stream, whatever we're going to call it. So for those who may not be aware, a couple of months ago, SKYGEN collaborated with Hanover Research to conduct what I think is groundbreaking research, a study of consumer preferences, wants, needs, all with regard to their dental and vision insurance. So from this study, we were able to produce the first of what will become the annual SKYGEN Pulse Report. The findings revealed not just consumer expectations. Obviously, that was a key component of it, but it really shed light on the strategic implications for payers, the pivotal role technology plays in fostering the growth in the sector, very hard word to say. So if you haven't seen the Pulse Report, I would encourage you download it. If you don't know how to get to it, that's easy. There's a QR code sort of at the upper corner here, and you can just scan that with your mobile device. That'll take you right to the report. You can download it. There's no cost. But today we're going to talk about that report. And with us, we are really excited to have Christine Tremblay. Chris is the Director of Product Management here at SKYGEN, and she's going to help to talk about some of the research studies, some of the stuff that we found in the Pulse Report, and obviously help us to connect the dots back to the technology. So I figured we should dive in. Chris, thank you so much for coming on today.
Thanks for having me, Holly. Excited to be here. The report that we're going to cover today really is packed with golden nuggets that I think payers will find interesting, and we'll cover a couple of the topics today and how our technology can help fill some of the needs that are called out in that report. So I'm excited to dive in.
Me too. So maybe we start off. Can you give us the 30,000-foot view? SKYGEN, obviously, we do technology, we do TPA services. How do we integrate consumer, so member feedback into our solutions? Again, that 30,000-foot view.
Sure. So like most software organizations, we have a particular preference to pull in the voice of our customers. And we think of our customers very broadly. Generally, our customers are payers, but their customers and constituents are providers, members, brokers. So we're always looking to get as much feedback as we can on the technology itself and understand the preferences and technology choices that those constituents are making. So in the consumer space, it's exciting because they're using all kinds of different technologies. Where we play a role is in providing digital technologies like mobile apps and web portals that can help them understand and utilize their dental or vision benefits.
Excellent.
So, yeah.
Exciting stuff. So now I'm going to go ahead and pull a quick statistic out of the research study, out of the Pulse study, and just get your opinion on it. So I am going to read this piece. With 40% of consumers seeking more diverse coverage options and 64% of those same consumers emphasizing the need for easy access to comprehensive information. How can technology, or how about our technology, what can we do to actually facilitate the transparency they're looking for, the comprehensive information, diverse options, et cetera? How do we do that?
Great question. So I think there's a few different contexts here, but we'll start with the selection of a benefit plan. We have tools that can help our payers facilitate a consumer's decision on what type of insurance to buy. So think about your experience with Amazon. If you are shopping for virtually anything on Amazon, you'll see a grid that shows you the thing that you're looking at and a comparison to maybe two other things that are also on offer on Amazon. And you can easily kind of scan the features of the product and understand the differences. And so we have a similar technology that we've implemented for payers to do exactly that. There's often choices between benefit packages, and they're difficult to understand, but you can lay them out in such a way on a screen, sort of side by side, that helps consumers understand, oh, there's going to be a $1,000 annual maximum on this one. There's going to be a $2,000 annual maximum on that one. That's just a simple example. But technology, online technology specifically, also allows you to drill down into descriptions of what's really covered. How is this insurance going to work? I think a lot of the dissatisfaction that we hear about is that, somebody makes a purchase, that they then go to utilize that service and they find that it's not what they expected. It doesn't really meet their needs. Unless you're kind of an insurance geek like myself, you're not going to understand what a missing tooth clause is, until someone takes the time to explain that to you. And if you see that dentures are covered, but then after the fact find out that not for the teeth that you actually have missing before you took the plan, then you are going to be disappointed in the coverage that you purchased. So I think, technology can facilitate being specific, being clear, allowing a workflow that leads maybe to a person at the end of that flow, so that, if they can't make a decision digitally online, maybe they can reach out to someone in your call center that can, explain the nuances that they couldn't deduce using the technology. So I think that we can bring the technology to the table, help our payers design workflows that really work for them and work for the consumers, and essentially boost, the engagement with members, right through to from purchase through to utilization.
That's fantastic. It's, I agree 100%. Just as a consumer myself, how challenging it can be to understand all that information and to have it all laid out in one place. That kind of comparison view that you described would be very useful. And of course, a person to ask questions, because some of it doesn't make any sense. It's really hard to understand if you're not embroiled. I remember, things that I've thought and said and done in years gone by before I worked for SKYGEN and had learned so much about the dental and vision industries. I definitely didn't understand a lot of things. So I think it's great that there are options that allow the consumers to learn more and understand more. And then, like you said, that connection to a human. So let me throw one more stat at you just for fun. Because you kind of intimated, and I'll give you a second to talk a little bit more about it, but nearly 1 in 4 consumers said that web portals and mobile apps are really important to their experience. So how, obviously, the existence of the web portal and the mobile apps and so on and so forth is fantastic, but what can we do to make sure that these type of digital tools are being leveraged the right way and helping to actually meet those member preferences and enhance the convenience and the understanding and so on and so forth?
Yeah, I think, you've got to offer super flexible platforms that meet a person's needs. So, one of the unique differentiators for our member web portal is really to allow the person in the family who acts as, like, I call them the healthcare CEO, meaning there's someone in every family that, makes all the appointments and shuffles the kids off to the dentist or the vision provider, that's worried about, the balance billing that might occur and, getting the books paid, with the dentist. They're doing all of the research about which orthodontist they should choose. And, that's generally one person in the family, the healthcare CEO. So we have a really nice delegation model in place that can help, um, get families to adopt the technology because they could manage all of the family members in one place. See the claims activity, book the appointments, find the specialists, do kind of all of the tasks that frankly none of us have time to do over the phone, by calling up a call center. So those digital tools, really enable people to do that at night and on the weekend and when they have the spare time to get those tasks done. So that's just one aspect, I think, of a really flexible offering that can, help move the needle on adoption. Make it easy, make it comprehensive so that people feel like I have this tool in my hand. I can do everything I need to do that's related to my dental or vision coverage right here. And I don't have to pick up the phone. Um, our call centers these days are mostly also chat based. So, there's a way from the member web portal platform to, instantly connect to someone at a call center just using the IM tools. And that's asynchronous. You could do it while you're at work, kind of in between, and you're not stuck on a phone call, waiting for someone to pick up the phone and taking half your lunch hour to get a question answered about how a claim got paid. So I think those kind of tools meet members where they are and help them to deal with any exceptions that they need to at their convenience. The member web apps of today are phenomenal. They facilitate just so much interaction, kind of two-way interaction. So, there are instances where a payer really wants a member to know something. Maybe they want to remind them that, 3 people in your family are due for exams and cleanings now. You should get those booked. Those kinds of push notifications are perfect. A huge money saver. People are very used to getting notifications on their phone these days, on text messages and so forth, and be able to take action. It saves money for the plan, to not be robocalling or sending postcards to folks. So that member mobile app in particular can really be, a two-way conversation if need be for the payer.
That's fantastic. And that's really good because, our research also found that about 49% of consumers said that their dental health is less than optimal. And then we found that 1 in 5 people reports, which doesn't sound as bad as it really is until the dollars and cents get involved, but 1 in 5 people report that they've had to seek treatment in the emergency room because something's gotten out of hand. Now, I realize there's a bunch of different angles to this. Obviously, there are accessibility issues and so on and so forth. But, that convenience you're referring to where you can more easily find providers and know what your coverages are and so on and so forth would be a huge help. I wonder that with, accessibility, looking at that in particular, clearly we can't make doctors appear out of thin air. If they don't exist, they don't exist. But what other things can SKYGEN do to help to facilitate those accessibility challenges in addition to the wonderful thing of meeting the member where they are, as you'd said before, with the apps and the portals?
Right. Great question. I think, COVID really changed the game for all of healthcare, right? And got us to think differently about the delivery of care and accessibility in particular. And where telemedicine was something that was very rarely used in the past, it's now table stakes, in the array of options that we have to get treatment. And that same is true for dental and for vision. Very exciting undertaking for us to integrate with a teledental provider that's accessible through our member mobile app. So that's a really exciting feature set that helps to meet the need. Certainly, everything cannot be done remotely in the dental context, but for someone who's in pain, who is in an emergency situation, who might be considering going to an urgent care center or an emergency room, which both are costly in most cases, the ability to connect on demand using your phone, and that doctor to be able to leverage the camera to maybe look at what's going on in your mouth, send a prescription potentially electronically to your pharmacy to get you out of pain until you can take the next step, which is probably a face-to-face visit, and then facilitate getting that booked for you so that you can walk in someplace on Monday morning and hopefully get treatment. That would be the happy path, right? The ideal situation. So teledental has its space. It has a space in rural areas as well, where care isn't exactly close by, and help smooth the path for a diagnosis or a treatment plan, and help coordinate that. So I think telemedicine overall, for our overall health and for dental specifically, has been a win-win for patients and for plans to be able to break down some of the accessibility barriers. So that's great news. So it's just one thing that we can bring to the table there. There's also, keep in mind our tools allow you to find providers, not just based on who's closest to you, but also who is the best fit for the problems that you're having. So our Provider Select Suite program assigns ratings to providers based on dental best practices. So who's doing what in the community that's actually improving the dental health of that community and steering people to those practices. So it's not like, who got the most stars on Google from a consumer perspective. It's from a quality of care perspective that these network ratings are developed and used in our Find a Dentist technologies and our teledental technology specifically.
That's fantastic, especially considering that you're finding a doctor that not only, like you said, not only is close to you, but is being qualitatively ranked based on, I don't want to imply that Google ratings are not legitimate, but we both know they're not. At least it's a real quality.
Right? It's one aspect. It's, how long did I wait in the waiting room? Or
exactly. It's often very superficial. It has nothing to do with actual quality of the care that you're getting. So I love Google. I'm not trying to be mean to them. Totally, not being obnoxious, but it is a different thing. It's very superficial. And quite frankly, I remember years ago, I used to work in a doctor's office, in a physician's office, and my doctor that I worked for would always refer out to this one other doctor, and he would tell everybody, listen, bedside manner, non-existent, but deal with it. He's a magician in the operating room. And unfortunately, people give lower ranks for that, but it's true. They may not have the greatest bedside manner. They may not have the prettiest waiting room. It might be that they were delayed and you waited long, and then you get these low scores for somebody who might be a truly fantastic practitioner. And in my opinion, it's more important to get quality care than quick care.
Right.
So I think that's a really valuable service that Provider Select has to offer.
I would agree with that. I think most people are worried about getting the best treatment. That's
Absolutely.
Right?
Absolutely. And especially when it comes to your family as well. Like you talked about the family CEO of healthcare. For my kids, I'm willing to take a lower quality for myself, but I would never pass that on to my children. So having that comfort, not that of course I'd want the best if I could get it, but when it comes to being that CEO, which I am in the family, I think that becomes even more important. So from a consumer perspective, that is really huge. How it's guiding you to the right kinds of doctors, not just the ones who happen to have an attractive waiting room and a short wait period. That's really fantastic. The one thing that, as a consumer myself and the consumers in our survey came back and said, and I wonder what we've got on this one, time and again, one of the biggest challenges, especially on the dental side, one of the biggest challenges is the fact that there comes that sort of surprise bill after the fact, because the estimate you got in the doctor's office or the dentist's office wasn't good enough. It wasn't appropriate. Something was not covered, et cetera, et cetera. Basically, 21% of consumers came back saying, this is just not okay. We need to have a better understanding of what the actual out-of-pocket costs are going to be, what's covered, what's not covered. How can SKYGEN help with that problem to appease consumers?
Yes, I think, across the board, a problem for healthcare in general, right? We're the only industry where you consume a service having absolutely no idea exactly what it's going to cost you. So that happens a lot on the medical side, and there's even legislation now around surprise billing and making sure that consumers really know what they're looking at when they seek treatment. It's no different for dental. And I will also add, since I've been in the industry for 20 plus years and spent a lot of that time on the provider side, if you don't set the right expectations with patients around what they might owe you, you may never collect that. They may never really have agreed that they were going to kick in that portion, whatever it turns out to be. So it's in everybody's best interest to really know early in the treatment cycle exactly what the financial out-of-pocket costs are going to be, what insurance is going to cover. And as you know, insurance is limited on an annual basis. It's not an unlimited pool of funds. So there's always that tipping point where you've exhausted your benefits in a calendar year and you're going to pay out of pocket for anything else until the new year kicks in. So the real way that we can help with that is in the office, on demand, real-time treatment plans that we can process through a platform that we manage called the Dental Hub. That's where providers can enroll to do business with the health plans that they care about, the dental plans that they care about, and interact with them online for a variety of things, all kinds of revenue cycle transactions, including the submission of claims and checking of eligibility. But I think one of the most valuable services for the consumer is the real-time treatment plan. So the ability to say, if I do these 6 procedures on Mrs. Smith, what is the coverage going to look like? And that will instantly or within minutes come back with a very detailed estimate around what's covered, at what level, what the plan would be expected to pay, what the patient would be expected to pay. And that then facilitates the conversation in the office before treatment is rendered about, what does this path look like? Can you afford to do this? Should we be splitting this up over a period of time to make it more palatable to afford the care? So I think that's one of the most valuable tools that we have. Pre-treatment estimates are another word for that same thing. And they're not a promise of payment, because certainly there might be like a claim kind of hanging in the works that might consume some of those dollars that might have been earmarked on the treatment plan. But it's a good best practice for those conversations to happen and not wait until after the fact.
That's fantastic. So it helps to give you a more real-time view of what you can expect to be covered, not covered. And yeah, from the consumer perspective, gives the consumer then the option is if they're doing, extensive work that might have a lot of out-of-pocket costs, they know that. And they can start to figure out any kind of financing options that they might need. The beauty of it is, I think, based on what you're describing, it takes a lot of the guesswork out of the estimate because it is actually being processed in a new way. And I know Dental Hub also has the real-time EOB, so you can actually push through a claim and immediately know before the patient leaves what amount of money they're going to have to pay. So they're in the office, get the treatment, immediately process that claim. So that's pretty fantastic as well. So I think that's great. I know from my perspective, again, I'm kind of pretending to be the consumer now because I've been to the dentist. I've got teeth. At least so they tell me. I had a situation where, again, I went to the dentist and I got a bill months and months later. And why this is interesting is because it was a shocker, and I was livid. This is before I worked for SKYGEN, before I had any knowledge of the dental industry. As I intimated before, I do have some medical background, but not dental was new to me when I first started here. I was irate about getting that bill in the mail because I paid in the office. I thought I was done. And I ended up, severing ties with the dental practice. I blamed the doctor for making the mistake. And to that doctor's office, if you happen to be watching, I'm sorry. I was so wrong. I had no idea how this thing worked. So hopefully they see this at some point and they're going, yeah, we tried to tell you. But the interesting thing is that I think that's a big challenge on the provider side as well. Not only do the consumers get really frustrated by the fact that it's, a surprise, but then the dentist's office sometimes gets the blame for this lack of transparency, lack of understanding. So it really just shows how valuable a service like the Dental Hub can be, giving you that real-time, treatment plan processing and the real-time EOB. And the reason why I bring that up is because in 2023, at the end of 2023, the research that we're referring to here, the Pulse, was actually consumer research. However, in 2024, which we are just gearing up to start our research engines again with our partner Hanover Research, we are actually taking the Pulse in another direction with providers. So we're going to be getting their perspective on all this and start to understand what the providers think of the industry, what could make their experiences better. And again, it'll be the same take where we're looking for opportunities to sort of merge together the feedback from the providers with what the payers can do to solidify the communication, the relationship, et cetera, to try and make a more cohesive, more unified dental and vision environment. So something that I'm really excited about. The Pulse is an annual report, but it is working in a rotation where we're going to be doing that, consumers 1 year, providers the next, and the third year will actually be employers and brokers. So really exciting stuff for the Pulse. Again, you've got the QR code on your screen. Feel free to download it. You could also just do a quick Google search and find it, or come to our website. It's listed there. Christine, I think this was fantastic. I've asked you all my questions for today.
Great.
I appreciate you spending some time with me, and I appreciate everybody who took the time to watch us. This was a fun live stream. I had a good time. Hopefully there will be many more live streams in SKYGEN's future.
I'll come back anytime you invite me. So,
I will. I absolutely will. You were great. You answered all my questions, and I think we got a lot covered today. So it was very exciting. And of course, to those who are watching, I want to thank you very much. I know everybody's got a busy schedule at work and things to do, so taking the time out to spend it with us is really appreciated. So with that, I guess we'll call it a day. Thank you again to everyone, and have an absolutely wonderful rest of your afternoon and wonderful rest of your week.
Thanks, Holly.
Thank you.